Welcome to another session of Parent University On Demand. Today, we're excited to have some exciting guests to talk about how to seek help for DCPS students who may need mental health support. So let's jump right into it.
Well, good morning, Demelza. My name is Nigel Jackson, and I'm the Director of School Mental Health, specifically for social work here at DC Public Schools. My team's job is to support students in their social and emotional well-being. Let's talk more about how DCPS students can access mental health support at their school. It's actually a very simple process, all right? First thing you do is you contact your child's school, right? You reach out to either a teacher or a member of the administration or someone you know at the school and just say, I'd like to get the universal referral form, okay? And you can express your concerns about your child's mental health, and you can inquire about accessing school-based support, all right? So once you request the universal referral form, you ask the staff for the form that's specifically designated for mental health services. So our universal referral process for mental health means that it's the same at every school in Washington, D.C. for DC Public Schools. There's one form and one process. That's why we call it a universal referral process. And adults can refer a student that they have concerns for, but also students can refer themselves. Okay, so it's not just one way. Students can refer themselves. You might have a friend. A student might have a friend that they want to refer. A student might want to refer themselves. A parent might want to refer a student. An adult might see another child and want to make a referral for them. But it all can be done with the universal referral form. The referral forms can be found on the DCPS School Mental Health website, on the DCPS School Mental Health Instagram page or Facebook page. We have a writable form, an actual paper form, or electronically. And all of our forms are available in English, Spanish, Amharic, Vietnamese, Chinese, and French. Some of you may have seen the QR code, which is accessible via your cell phone, but we also have a QR code. It's in the enrollment paperwork, but that's another way to access the electronic version of the universal referral form. That's through our QR code. So you would complete the referral form. You'd fill out the referral form with the accurate and detailed information about your child's mental health concerns, and if applicable, return the completed form to a member of the school-based mental health team. That's if it's the paper copy. If it's the electronic copy, it will automatically get submitted to the right person. Then you just follow up with the school. After submitting the form, you can inquire about the next steps in the process. The school will inform you about the timeline for review and provide updates to you on your child's referral. The school will work with you to develop a plan for resources and support that address your child's mental health needs. This plan may include individual therapy, group therapy, or community-based resources. One of the questions that we get about the referral process is, how long does it take? If I submit my application, when can we expect services? So the referral forms are received by each school's mental health team, and they will review them within 10 business days. It may be shorter than that, but they all will be reviewed definitely within 10 days. The electronic forms that are submitted go directly to each school's school behavior health coordinator, or what we call SBHC. Each school has one, and that's the person who leads the team meetings after those referrals are submitted. If you complete a paper copy, any school administrator can get it directly to the SBHC if you're not aware of who that person is. So just bring the form to your school and give it to an administrator who will bring it to the SBHC. We know that parents and caregivers sometimes have concerns about the process for mental health services. So I'd like to just speak a little bit to some of the concerns that we hear from parents around making referrals for mental health. Sometimes there's a stigma attached to mental health. So some parents worry that seeking mental health services for their child could lead to stigma or judgment from others. However, it's very crucial to remember that mental health is just as important as other aspects of health, like your physical health. Seeking support is a positive step towards your child's well-being. Accessing mental health services does not negatively impact a student's immigration status or application process. Another concern that we hear from parents is, well, how good are the services at the school? How effective are the services? And my response to that is, have a conversation with your school. Meet with your school's mental health team and ask them. Ask them about their qualifications, their expertise, their areas of interest, research, experience. Because if you as a parent are going to fully participate in the referral process, making a referral, sending your child somewhere, you want to be comfortable. So we encourage you to have a conversation with the school-based mental health team at your child's school so you can become more comfortable with the person who would be working with your child. Another major concern from parents that we often hear is, well, who will get this information? You know, if my child meets with somebody, how can I guarantee confidentiality? Schools have protocols in place to ensure that this sensitive information is handled appropriately. So your child's mental health information and other information will only be shared with the relevant professionals working with your child. Schools do not ask for the immigration status of families within the district. Sometimes we hear this, not as much as the other ones, but sometimes we also hear, do you have enough people to support my children? And the response is that, yes, we do. It's very important to have an open communication with the school staff to understand the available options and explore alternative resources if necessary. You can find the contact information for members of each school's school-based team on our school mental health website. You know, sometimes people say, well, how do I know who is the school-based mental health team at my school? If you go to our website, you can access who that person is at your child's school.
Thank you so much for all that information. I think you covered a lot of the frequently asked questions families ask, but there are a couple I wanted to make sure to get in. The first one is, you covered like information being shared. Can you talk about how this information is shared?
Before we can begin supporting your child, we want to make sure it's clear what you and your child are agreeing to, including how the information will be shared. So the DCPS mental health teams review all the referrals. So those members would review this information. The teams include DCPS employees, like the school social worker, school psychologist, school counselor, and we have mental health partners through Department of Behavioral Health and our community-based partners. These are agencies that partner with DC Public Schools that are community-based agencies. So not only do we have DCPS school-based employees, but we have partner agencies, partner mental health agencies that join with us to support our students. So the school nurse is also a member that sometimes may be a part of the discussion, depending on the needs of our students, but the school counselor, school psychologist, school social worker, and partner agencies and nurse, if necessary, would be people who would be discussing your child's mental health needs to put together the best plan of support. Non-DCPS employees, meaning like our partner agencies, our partner mental health agencies from Department of Behavioral Health and the community-based organizations, they complement the school-based team and they participate in the review of these student referrals. They receive referrals for students the team feels would benefit from their specific resources. Along with the referral itself, the school also shares basic information with the partners so they can best support the student. This sometimes includes presenting concerns. It includes like, what are the students' strengths? What is their academic data, attendance data, behavioral or discipline data? This is considered basic, baseline information that helps our partners create a plan of support specific to your child's needs. In schools, consent means both saying yes to services and yes to sharing of general updates. Your child will be discussed as a part of educational planning. Our partners then will share back with DC Public Schools mental health team like treatment goals, progress towards those goals, or if progress is not being made towards those goals. They'll also share behavioral observations such as what are the child's triggers, what sets them off. All of this is done for the purpose of continuity of care. This information sharing between mental health partners and the school prevents barriers to your child's optimal school experience. Any additional information beyond what is stated above needing to be shared with DC Public Schools will require signed permission from the parent unless the situation is emergent. If you, as a parent, do not want to consent to both service delivery and the sharing of information back with the school, then the school mental health team will make every attempt to link your child to a DCPS employed school-based mental health professional. Again, it's important, to note that DCPS and our mental health partners all work together as one team. And we believe that this exchange of information is in the best interest of coordinating an approach to supporting students at the school.
Thank you so much for your response and for all that information, Nigel. We do have a second question, and that question is, if my child does not have an individualized education plan or Section 504 plan, can they still receive school-based mental health services?
This is a very common question that we get, and I want to be very clear with my answer. The answer is yes. Every single student in DC Public Schools has access to mental health services, whether they have an IEP, a 504, or are general education students. Every single student has access to mental health services. You would simply utilize the universal referral form that we discussed earlier, or just contact a member of your school's administration or mental health team to access that universal referral form.
So let's get ready to close this out. So we covered a lot of information, and we know families are really busy. And so just thinking through the conversation we had, what would be the most impactful actions that families can take if they're considering a mental health referral for their child?
I have two. The first one is have a conversation with the person at your child's school. Have a conversation and ask your questions. If you hear something negative, like, oh, my school doesn't do this well, or my child's school doesn't have this, ask somebody at your school. Say, hey, I'm hearing this. Is this true? Or what is the actual truth? And let the school share with you, a response to your concern. So have a conversation is very, very impactful. That's number one. And number two is access the information that you might be looking for through our various channels, our school mental health page, our Instagram or Facebook page. use our QR code, will take you there. On it is the referral form itself and other information, including resources and valuable information that you may benefit from. So have a conversation and access our mental health pages, and our universal referral form is one of the things, including others on that page.
Thank you so much for sharing all this information and for being with us today, Nigel. We truly appreciate your time. Families, please look at the description box in this video to find the resources that Nigel mentioned, such as like the website and the universal referral form. Also in the description box, you will find a survey. Please take 2 minutes to answer the short survey. We want to know how this information was useful to you, if it was useful to you. If you have any other follow-up questions, this is a way to get that information to us, so we may reach out and put out more resources for you. As always, you can always follow us via social media platforms or by email at parentu@k12.dc.gov.